Well, Planetree is a very unique organization in that it was started by a single patient, and a patient who had an otherwise typical experience in a hospital, but came away from that experience feeling that it was worse to actually spend time in a hospital than to almost die.
It wasn't my own experience being hospitalized. I was quite young. I got a mystery virus that never got identified. But after being checked into the hospital, I quickly started to have this anxiety and fear. And I would ask questions and they'd tell me to ask my doctor. They'd give me pills, they'd do things to me that I didn't know what they were. And I just sank into this despondency. And when I started coming out of it, I felt that I either had to do something about the way people are cared for in hospitals, or I had to go back to Argentina where at least the technology wasn't as good, but the human aspect was there.
Planetree really started to focus on patient-centered care before anyone had even heard of the term. I mean, 30 years ago, Angelica Thiriet's vision was to look at everything from the patient's perspective and then to use that almost as a guide or a blueprint in making changes in the way we deliver care.
Over the years, what we kept finding is that what patients want were the same things. They assume they're going to get good medical care, but what they said they wanted was good human care, and that was what was missing.
The difference, I think, practiced in a Planetree environment is that you're looking at the whole individual as a complete system, mind, body, spirit.
Planetree is a sycamore tree, and it's the tree that Hippocrates taught his students under in the days of ancient medicine, and that really symbolizes going back to the days of listening to the patient and including them in healthcare decisions.
The Planetree model has 10 core components, and each of those components plays out differently in different hospitals. They come up with innovations around these things, but the components themselves have really stayed the same through time.
One thing that we heard over and over that patients want is what we call human interactions. They want kindness.
Having a program like an ambassador program, which is something many of the hospitals we work with adopt, is wonderful. So they come in those front doors, and the first thing they see is this smiling face of an ambassador who actually greets them. Where are you going? Let me walk you there. I'll make sure you get to your appointment on time.
One of our nurses in the intensive care unit recently was working with someone who was a little bit confused, didn't speak English, which is very common in our hospital culture because we are so diverse. And we realized that this poor little lady who was at high risk for falls was upset because she was in the bed so much. So we took the bed actually out of the room, put 2 mattresses on the floor, and this patient was so happy.
One of the things that I think that caregivers forget, nurses and all caregivers, is that we're creating memories. And how do we want to be remembered? Do we want to be remembered as mean, cruel people, or do we want to be remembered for doing something kind and caring for someone?
Really challenge hospitals to look at the physical environment because there's some very profound but subtle influences on human behavior and the way that we feel based on the physical environment that we're in.
I believe that one of the most important elements is respect and dealing in architecture, that the architecture be respectful of the patient. What I've attempted to do is to make sure that it's closest to the home environment as possible. At the same time, allowing the patient to feel that he's in a comfortable environment but has the best technology available. One of the other key elements is with the small leafed trees. You can hear the music and the noise coming from the trees. It's beautiful. It works well.
In designing the garden that we're in right now, we wanted to create an image that would be seen by everyone who was going to come to our facility and determine that a garden would be the most effective use. And it would also be in conjunction with the Planetree principles.
Most hospitals are the most intimidating institutions. They're frightening and ugly and plain and scary. So how can we make hospitals be healing institutions, places where when you walk in the door you feel better, which is so different than the way most hospitals are.
So we really help hospitals to look at their nutritional practices, both from the quality of the food, but also access and how it's being delivered.
The reason that it's important for us to offer authentic food to patients here in the hospital that are familiar to their culture is that it's a comfort. You know, when you're homesick and you're not feeling well and your mom brings you a bowl of chicken noodle soup, not only does it make you feel better, but it's a comfort. Seaweed soup is something that's not only a comfort food, but something that the Korean patients eat on a regular basis. For our moms that are Korean, it's something that they eat 3 times a day.
I was able to get 2 menus. I had the American menu along with the Korean menu, so I was able to pick little things that I was craving, like French fries, and I always had my seaweed soup that was given, and it felt like home, and I got the nutrition I needed. And when you're comfortable and your mind's at ease, you're gonna get better, and I feel like it's all connected.
It's so important to look at food both in terms of the nutritional aspects as well as the nurturing aspects. Food makes people feel better when you're upset, when you're depressed, and certainly when you're sick.
Fundamental to Plaintree, though, is the belief that if you provide patients with information, they can become active participants in their own care. So we've done that by offering patients information through our Health Resource Center, which is the largest collection of consumer health literature in the country.
Access to information is a key part of Plaintree, and they believe that it's important to nourish the mind and spirit as well as the body. So we try to keep patients well informed, and we do that with the open medical record. We encourage patients to look at the record, and if possible, we try to sit down with them and do so. We encourage patients to actually make entries into their patient chart.
As part of reviewing your chart, when we talked about your healthcare directives, we indicated that you would have full support, namely that we would do everything available should you get sicker than you are now.
One of the things that we look at in terms of the Plaintree components is what's the effect on patient safety. We know for a fact that through education we empower patients to care for themselves, and what we see are fewer infection rates. We recognize in the hospital that once the patient leaves the hospital, their care isn't complete, and we know that there's somebody who's going to be taking care of them, whether it's at their home, hopefully at their home, or wherever else they'll be going. And so it's important to involve the family up front.
So Plaintree listened to patients who said, I want information. So that's partly why Plaintree has an open chart policy where patients are encouraged to read their medical record. And not only does it help patients feel empowered, but from a patient safety perspective, it's phenomenal.
Our policies allow for family members to be involved in the patient's care. We offer a series of amenities to patients, everything from the kitchens that we have, residential kitchens that we have on our patient units, to unlimited visitation.
I think Plaintree means that when a family member's in the hospital, the whole family is going to be considered.
I think Plaintree helps with the diversity in this community because it respects all the different ways that people perceive their health care and perceive their lives. We deal with many faiths here. We deal with many cultures, which means that some, how some people want to have their privacy respected is totally different from other families where people want everybody included.
Now we know that families are good medicine. So how can we include families in the care? And not only are families good medicine, all the studies show that social support is vital to good health.
Planetree believes strongly in spirituality, and we're not talking about religion here, where religion's based on certain basic principles, but this is more of your inner self, your inner well-being, your basic belief system. And doesn't it make sense that if we can have patients have a positive attitude, that their outcomes will be better?
Spirituality is a component of the Planetree model, and it's one of those things that used to be the S word in many hospitals. People didn't know what to do about the spirituality piece of the puzzle. And we've said since day one, patients are not just these broken bodies that come to you to fix. They're individuals with bodies, with emotions, with spirits, with intellect, and you need to engage them on all of those different levels in order to help them to heal. So for many patients, it's not just a physical crisis when they're in a hospital, it's a spiritual crisis.
When you're talking about health care, you're talking about healing. And if we can heal people's bodies, and if we can heal their spirits or their psyche, whatever it happens to be, then it's very satisfying to see that.
Human touch, it's such an important piece for humans to be touched in a caring way. You can convey so much through that. So the hospitals that we work with find innovative ways to bring caring touch back in, and it could be a soft touch program where volunteers are trained to do hand and foot massage for patients.
Massage therapy seems to fit in very well with Planetree. Basically creating better patient-centered care, treating the whole person rather than just their illness or their condition. When you can physically use your hands to help somebody feel better, whether it's physically or emotionally, it just sort of makes my day go better. So just knowing that you're helping somebody is basically the best gift you could get.
It's absolutely wonderful, and I think the first time that it was massage was offered to me, I was a little apprehensive, but once I was able to feel it, it really does make you feel better.
Whether it's as simple as holding somebody's hand or just touching their arm or just touching them in some caring way, even just putting your hand on their foot when you walk in a room just to say, I'm here and I know you're there.
Arts and entertainment is another thing. Patients also often find themselves either waiting for different tests or treatments or just sort of, sitting in these kind of bare rooms, uncomfortable, in pain, without a lot of distraction. So how we can bring positive distraction into the environment can be a challenge, but many of the hospitals that we work with have found fascinating ways to do that. Everything from clown programs where clowns make rounds on the units, to volunteer baking programs where volunteers will bake muffins and bring them around to patients, to the pet visitation that I mentioned, to arts and crafts programs, volunteers who may bring those kinds of activities into the rooms. Anything that helps to lift the patient's spirit.
When I play my music and I see patient faces and I see even I will touch one in 1,000 who will sit next and listen my music, and I see that I give them some hopes.